The budget's on Thursday, but the government's already opening the vault and health is today's lucky recipient. The Prime Minister unveiled a $164 million package to turbocharge urgent and after-hours care, pledging 5 new 24/7 facilities nationwide. But critics say they won't be able to staff this promise, and some of the most vulnerable areas are left off the list. Senior reporter Juliet Speedy has the details.
It's a commitment to round-the-clock care.
Our government is investing $164 million to expand urgent and after-hours healthcare services across New Zealand.
By bringing help closer to home.
This investment will mean that 98% of Kiwis will have access to urgent care within an hour's drive of their home.
The aim is to ease pressure on emergency departments and keep treatment local.
Obviously, the cost when you send someone into an ED, it's probably closer to about $800. When they use an ambulance, it's about $1,000. So actually, for us, this is like a really smart investment to make sure that we can meet people's needs where they are closer to the home.
Over the next 4 years, 5 regions will get new 24/7 facilities, with counties Manukau first in line.
Whangarei, Palmerston North, Tauranga and Dunedin. New and extended services identified for places like Invercargill, Lower Hutt and Timaru.
The package includes funding to recruit and train more primary care staff.
And that's where, more doctors being trained in primary care. Those overseas trained doctors who are unable to work here, making those placements available so they can actually start working in primary care.
One, to provide a pathway for doctors to come to New Zealand and practice as GPs, but we have to face the reality that we simply do not pay enough, and that means we're not competitive on the international market.
And he says that's by a long shot.
Well, I'm aware that other countries will be paying them 2 to 3 times more than what we pay. It's a huge pay gap.
And he says 2 of the country's most vulnerable areas have been left off the list.
I saw on the announcement nothing being planned for the entire West Coast from Karamea down to Haast, and also the far north. I've just come from the far north. I know that there are doctorless hospitals in the Bay of Islands, in Dargaville and also in Kaitaia.
Labor says this will plug some gaps, but it isn't enough.
It's well known that after-hours care is incredibly expensive for people. I've heard stories of people in Wanaka paying hundreds of dollars for after-hours care, so it isn't just a matter of keeping the practices open, the cost of care also needs to come down.
Now the government must prove it can not only build these clinics, but make them both affordable and fully staffed.